everyone, and welcome to Fresh Outlook. To our friends in the U.S. and around the world, we thank you for joining us. I'm Mia Toski. Now, if you're joining us for the first time, we take a look at the world with our expert panel. We cover international events here in the U.S., and we try to end our hour-long show with a look at some of the news that made us smile this week. So let's get started. We begin in Nigeria, where the president has declared a national emergency. President Jonathan even approved a plan to release nearly $12 million for an intervention plan and has asked schools to consider staying closed. Only 2 people have died in Africa's most populous nation. Is the president's plan a good one, or is it causing more panic?
Army roadblocks in Liberia to stop Ebola from spreading.
The government will institute extraordinary measures, including the suspension of certain rights and privileges.
In Sierra Leone, airport checks to prevent the virus from claiming more lives.
What we are trying to do now as airport authority is to ensure that no Ebola-infested person gets on board an aircraft to travel. We know this disease spreads through person-to-person contact.
The World Health Organization says the Ebola epidemic is now an international public emergency.
The committee's decision was unanimous. Its advice to me acknowledges the serious and unusual nature of the outbreak and the potential for further international spread.
Head of Health Security, KG Fukuda, says patient isolation to prevent transmission is crucial.
This is an infectious disease which can be contained. It is not mysterious.
Nigeria's President Goodluck Jonathan has also declared a national state of emergency and approved $11.6 million of emergency funds to contain it. Ebola has no proven cure, and there is no vaccine to prevent infection.
And joining us now is former White House aide Dee Dee Benke, and also my co-host. We also have political psychologist Dr. Bart Rossi. We have international journalist Tom Swisteri in our D.C. studios. And we also have Scott Manji here in our studios as well. And via Skype, we have Ed Mitchell, the CEO of Medizone International. That is a leading infection control company based in Sausalito, California. We welcome everyone. Well, we just were watching that story there, and we saw people that are still traveling outside the African nations. Do you think that we're going to see a ban on some air travel? We'll start with you, Dee Dee.
Well, I hope so. If there's a cause for Ebola, look, I mean, they said that there's no cure, there's no real vaccine, and it's still, I think it is mysterious. I don't understand why in the world we would bring Ebola patients back to our country. I mean, maybe we use Gitmo for that. I don't know, but why play Russian roulette with the population of our country? And you know, they said that the doctor was shaking hands with the sick patients, and that's how he got it. I thought it was supposed to be bodily fluids. Is it or is it not? I don't know. I still think there are questions that need to be answered.
And what do you think, Dr. Bart? I mean, that story there, they're saying, you know, they were going to close the borders last week in Liberia. Now we're seeing that people are still traveling.
Well, I think Dee Dee's sensitivity to this is probably on the mark to a great extent. However, I think the media has done a really good job of highlighting that this is person-to-person contact, it's not airborne, and it is containable, as the doctor just said on your piece. So I think that we have to measure this in terms of what it really is and deal with it as it is. So I don't have a problem that the doctor came to the United States, precautions were taken, he's getting better, and it seems like it's contained and they're doing their job. But I do understand Dee Dee's sensitivity to this and everyone's. And
Scott, you know, last week we obviously were talking about Ebola again. Just where do you fit into this? I mean, what are your thoughts?
Well, it's vitally important to find the people who have it. So far, the only real treatment is to find the people who have it and separate them from those who don't, so that it doesn't spread. And then, sadly, you wait for those people to either get better or die on their own.
So we also want to check in with Ed Mitchell. He's in Sausalito, California. Now, there's so much fear, as you've heard our expert panel here talking about. Is there anything new? I know that you were working on some sort of a disinfectant. If you can explain that to us.
Yeah, one minor correction, it's Marshall, but that's okay. We have our company has developed a system called Aseptic Sure up in Canada, working with the National Research Council of Canada, the viral vector section, and Queen's University, where we have laboratories. This is working with some of the finest scientists in the world. Retired Deputy Surgeon General Canada, Michael Shannon, ran CDC Canada for 3 years. Dr. Dig Zalman is a professor at Queen's University, infectious disease, things like that. And what we just demonstrated working with the National Research Council was that we could kill coronavirus and norovirus and different viruses quite easily. We had already worked through the bacterial pathogens. And on the biological resistance list, the not to get deep in the weeds, but spore formers like C. difficile and anthrax, which this system has defeated completely, are much harder to kill than any viruses. And Ebola is actually easier to kill relative to the biological resistance list than what we've already worked at Queen's University and with the National Research Council in Canada.
Well, Mr. Marshall, let me ask you a question on that. Why are we seeing such a rapid spread of Ebola then? What is different with this strain? I mean, we haven't seen anything like this in nearly 4 decades.
I'm not qualified to answer that. If you had one of my scientists on, maybe we could. This is very similar to SARS, when the SARS outbreak happened in Canada, and the Canadian, that was about 2003 in Toronto. And these same gentlemen worked on SARS, and they got that under control quite well. We saw it with MERS corona in Saudi Arabia and the Middle East, and now we're seeing Ebola. The frightening thing about Ebola is that the mortality rate is so high. And from that standpoint, we personally believe that it's very, very important to make sure that the rooms where these patients are, such as at Emory, we'd love to see our technology at Emory, for instance, because we would just be protecting the healthcare workers so much. But
and very quickly, for yes or no answer on this, do you think that the 2 Americans should have been brought into the U.S.?
I don't have any problem with that at all.
Okay. Well,
on your question about why it's spreading so quickly compared to past outbreaks, that has, I think, more to do with the social environment than the nature of the disease itself. It has been occurring in Central Africa, in places where people don't move around that much, and they stay in the same place. They can be found and isolated. Whereas this time it's occurring in West Africa, where many people are still desperately poor, but they're more mobile. And it takes maybe 3 weeks to find out that you've got the thing before the symptoms come. And in that time, you may have heard there's a job in the next country and you're gone. And by the time you get the symptoms and become contagious, you're in a whole different environment.
Yeah, there's a 21-day incubation period. That is very scary. I mean, you got to have someone come across the border with Ebola, come to New York, get on the train, ride around the subways for 3 weeks, and guess what happens? It's a pandemic. And you know what? I don't buy this, that it could only be airborne, because it's interesting. If it's moving so quickly, what? They would have to vomit on them. They would have to kiss them. They would have to have the exchange of bodily fluids. Is that really the case? I don't know. I'm not sure anyone really knows.
Well, I think the experts say that that's what it is. It has
but that's happened before with diseases, and then we find out that it develops. And we talked about SARS and why in the Asian countries SARS they would wear the mask.
But we also don't want to make it something that it's not.
We don't want look, if it's the mortality rate, I mean, look, people die with this. I mean, it is so drastic that you've got to take it seriously.
Well, in Nigeria, they're saying they're putting $12 million into prevention. I'm not exactly sure where that $12 million is going, but obviously they've declared a national emergency as well. So there are now 4 West Africans,
Yeah, I mean, I think that we're taking this seriously enough, and I think that the countries are, and they're putting money into it, and hopefully that we'll get past this whole epidemic. We'll get past it, but I don't think we should really focus on what it's not. We should focus on what the experts say it is and deal with it appropriately. And I think that's where we're going with it, and I do like that. I do like that feature of this.
And of course, our friend Tom Squitieri in Washington, D.C., you've just returned from Liberia, and we were watching a story earlier before just a few minutes ago, and we saw a lot of folks that were traveling still by airplane coming out of some of the countries. Do you think that's wise? I mean, do you think that should be something that should be stopped by the governments now?
I believe that the people coming out of any country that has affected populations need to be screened and monitored carefully. We just can't shut down all air travel everywhere yet without some type of precautions. However, today, I believe it was this morning, the U.S. State Department issued a travel warning to Americans about traveling to Liberia, and I think they're going to start removing evacuating some U.S. Embassy personnel from that country. So it doesn't seem like the authorities are seeing the spread of it stopped. They're seeing still a crescendo of danger to take these steps to make sure that the disease stays in just certain parts of the world, certain parts of those countries, and not spread.
One of the things that we haven't really heard any of the top medical experts say is like how many people could possibly die from this? I mean, are we talking thousands, or we really don't know?
Well, wouldn't that depend on the social contact and how many people are actually touching?
Yeah, but
yeah,
in New York,
saying,
everybody's touching each other. Look, in New York in the subway, when it's crowded, everyone is this close. You could like sneeze and get enough bodily fluids maybe on someone, and then it spreads everywhere.
But there are other viruses that have
yeah,
just
but you don't die, Dr. Bart. See, this is what I don't get. I mean, I think that it should be looked at as something up. You know, you think, oh, hysterical, no big deal. I think it's a huge deal because people die from it. I mean, there is no cure. It's not the flu.
But I also think that there's the hysteria where if there's a 70-year-old woman who's sitting at home watching the television, the chances of her, the likelihood of her getting sick are really not there. I think that that's one thing that we, like you said, we need to make sure that people are fully aware of how you contract.
How you get it, and deal with it appropriately, because we don't want to get into what it's not. I just don't think that's the way to go with this. And Dee Dee's concerns and the fact that we should take it seriously, yeah, that's for sure.
But I would probably say, not to take any kind of that we've taken any kind of scientific poll here on Fresh Outlook, but I would probably say that it's split 50-50, because a lot of people are like, people shouldn't come here, and a lot of people are saying it's okay.
And some people are using it.
Go ahead, Tom.
Yeah, this is Ed. Let me make a comment.
Mia, one of the things that's happening in, one of the things, because they brought those patients.
Go ahead, Tom. I'm sorry about that.
Well, do you want Ed or Tom?
Well, I'd like to give both of you. How about that?
One of the things that's happening at Emory University, where they brought the folks in from Liberia.
Well, let me jump in. I think I have something to offer you here. You had asked me how I felt about the identified patients, the doctors being brought into the United States, and I said I had no concern about that. The reason I had no concern about that was they were identified as Ebola patients. They were in the highest level of isolation during transportation to Emory, and Emory is one of the finest facilities in the United States to care for this sort of situation. So that's not a risk, in my opinion, and in the opinion of the doctors I work with. However, Ebola is extremely dangerous, and what we need to be concerned about more than anything else is people coming into this country, into various areas of this country with Ebola, and no one knowing it until it's too late, and it does spread. So there is a very high risk. It's understated what the risk is.
Well, that's why my question was for a ban on air travel from certain places. I mean, even if somebody from West Africa goes to Europe and then comes into the United States, I mean, are we eventually going to see bans on travel? With the way that many of the doctors are saying. And obviously, Tom, you just came back from Liberia. And I think we are having a little technical problems. We do apologize.
Yeah, we got.
In
fact, yesterday was my 21-day incubation period.
I was going to say, Tom, I'm glad you're there, not here. No offense.
All right. Well, we are going to take a quick time.
Well, I'm fine. So don't worry. So I got through my 21 days, okay? But
phew! Glad you're going to make it. Glad you're going to stay with us, Tom.
Well, Tom, thanks so much. We do apologize for that delay to our viewers. We're going to fix that on our next break, and we'll be right back with much more, folks. We're going to be taking a look at some international news from the West Bank to Iraq. It seems the world is on edge, and fighting continues to rage in many parts of the world. More to come in just 2 minutes.